The resident doctors are doctors in training. They are medical doctors. That's one. Two, nobody can say that they will not get a practicing license till after 5 years. It will run counter to the laws of the land that have established the progression in the practice of medicine. I'm a medical doctor. When you graduate from the medical school, you go on 1-year apprenticeship called husbandship or internship, as the case may be. After your internship, you are now given a full license, because prior to that, what you have is a provisional license of registration with Nigerian Medical and Dental Council of Nigeria, MDCN. So after that internship, you are signed off by consultants and you became a fully qualified medical doctor to attend to human beings, touch them, and work without any supervision again. Supervision then is voluntary. Resident doctors are those who have that full license and they want to acquire postgraduate specialty. And the specialty is known. Once people know is surgery, gynecology, ops and obstetric, pediatrics, and medicine, internal medicine and family medicine. So they are doctors in training. So I'm taking your questions, the last one. The bill in the National Assembly cannot go to stop anybody from getting a full license. That's number one. Number two, that bill is a private member's bill. In the National Assembly, they attend to private member's bill and executive bill. Executive bill emanates from the government into the National Assembly with a stamp of the executive. It's either sent by the Attorney General of the Federation or so moto by President, but usually from the Attorney General of the Federation. So it's not an executive bill, it's a private member's bill. That bill is moved by the man from Lagos. I've forgotten his precise constituency, but he's representing a constituency. So members of his constituency can tell him, this is worrying us. Can't we check these doctors this way by you going to speak and put up a document? That document is, as far as I'm concerned, not workable. Ab initio. I don't support it, and I will never support it. Like I said before, it's like clean a fly with a sledgehammer. They should think of other ways. If they are trying to check brain drain, there's other ways. If a doctor has read on scholarship, you bond him. If a doctor has read on bursary, you can bond him. State governments still give scholarship and bursary. If a doctor is trained like we are doing now, on a little or nothing, which is like scholarship again, because 50,000 naira a session for a medical student is nothing. When their counterparts overseas pay 70,000 pounds for a session. So I don't support that bill. So you can bond them if you want. 200% salary increase, like I have also told you, these people are junior doctors. The NMA is the father of all doctors in Nigeria. And they have about 4 or 5 affiliates, of which the resident doctors is an association affiliating there. You have the Consultant Association, Medical and Dental Consultant Association, MEDICAM. They are the consultants who are training these resident doctors to become specialists. You also have General Medical Practitioners Association. And you also have private, people in the private. So NMA is father of all. including me. So NMA is already discussing with Federal Ministry of Health, salaries, incomes, and wages, and the Ministry of Labor. And we know that NMA has accepted a salary increase of 25% across board for their members, and 30% for between 25 and 30% for their members. So I don't know the logic by which now people who are members of NMA are now coming out to say, pay us 200% increase. It doesn't make sense to me. I don't understand it. So I have asked the NMA president to contact them. Because on the issue of remuneration negotiations, it's NMA that the government deals with. So I've told the president of NMA to contact them. And we'll engage them. They should not go on any strike. It's not necessary. A memorandum to the Federal Executive Council for the implementation, that is universal implementation of the Employee Compensation Act, ECA 2010. That law is a law that is operated by the Nigeria Social Insurance Trust Fund, NSITF, and is a replacement of the old Employee Compensation Act. That's what they call workmen compensation in the olden times. Today, the council has approved it for universal implementation, meaning that apart from the private sector that is already implementing, the public sector, which is government, federal government, state government, local governments, have now to adopt this for the protection of their workers. The Act provides that the worker who is injured or has an accident or contracts a disease or disabled or death even in the course of work should be compensated, remunerated, and even the family pay something when the man is no longer there. It even makes provision for some of the children to be schooled or educated up to age of 21. So today is a good day for the Nigerian workers because the decent work agenda that is contained in Convention 102 of the ILO has a major branch on what they call workers' protection in the course of work. So this is the law, and Nigeria today have directed that all workers in the MDAs, ministries, departments, and agencies of the federal government should be covered with a percentage contribution. It's an insurance premium, that 1% of remuneration. You pay it, and it insures the worker against this workplace accident or injuries. So that is what Council passed today, and directed the Minister of Finance and Budget Office of the Federation to make provision for it in the annual budget as social contributions. Under the subhead of social contributions in our annual appropriation as of today, you only have 2 items there. Number 1 item you get there is the pension contribution of employer. Second one is the health insurance scheme by the employer. So these are employers' business. It won't affect the salary of the worker. So the third item now added under this social contribution is the implementation of the ECA 2010. So the council, apart from directing the finance minister and the budget office of the federation, also directed the attorney general of the federation to spin this down to the states through their respective attorneys general, and the secretary to the government to also spin it out to all the parastatals and government corporations. An earlier circular has gone in 2012 when the ECA was operated for the first time, but council now approved that the SGF should reinforce that with another government circular today.